Firstly,
Morning.
do you think mistakes have been made?
No, I think I'm going to come back to this report. Honestly, I would advise caution on this news story because, first of all, we've got to get this into context. The reality about this was that the world did not realize the extent of the pandemic in China because it is quite clear now that China suppressed and hid information for whatever reasons we may yet discover, and that the World Health Organization, which has serious questions to answer, did not tell the rest of the world that this was a pandemic that was more than likely to spread.
With respect, Mr. Duncan Smith, let me interject there. I'm asking the questions, Mr. Duncan Smith. I'm asking the questions. I am asking the questions, Mr. Duncan Smith.
Let me finish this
I
point,
am asking the questions.
The reality here
if you let me interject there.
You've asked me a question. Let me finish
But what you're
the
saying
answer.
strictly isn't true,
No,
is it?
let me
you
finish
said
the
you said the
answer.
World Health Organization didn't inform the world about the threats. That's not true, is it? They told the world about the threat in January, so we were clear as to the dangers facing the country as early as January. Is that right or is that wrong?
No, that is wrong. The reality is that the World Health Organization did not interrogate China as they should have done about the release of the data. And most countries in the West were certain that this was under control in China. It turns out that it was not. That is the biggest problem. The second bit about this, which is quite critical, is that right now, every single country in the world is looking for exactly the same equipment. PPE equipment is exactly the point. Every other country is much in the same boat. It's not as though the UK is suddenly isolated in this. Every other country is having to cope with what is an unprecedented pandemic. And the point I'm trying to make, where you're interrupting me, was that this is a process which the government is trying desperately to get on top of and has been since the beginning. There are questions, yes, that will be asked, but later on, not now. We have no idea who's leaking this information, whether they're disgruntled or not. We don't know. But the reality is, questions will be asked, but it's right to ask them once we've completed this process, got on top of this, and then managed to get the country back up and running, which is absolutely fine.
OK, it is also right and fair to ask, though, whether a global emergency was declared weeks ago.
Sorry, I didn't understand the question.
It is right and fair for me to ask whether a global emergency was declared weeks ago by the World Health Organization.
It's quite right for you to ask questions, but the question here is really important. Is the government doing the right thing? Is it trying desperately, quite rightly, to obtain PPE equipment? Is it trying to support our frontline staff? Yes, the answer to those questions are yes. But is every other country doing exactly the same? Yes, that is the problem. This pandemic is on unprecedented scale, and every country is in exactly the same place, trying to get the same equipment from the same suppliers. This is the key problem. In Italy, in Spain, in France, in Germany, and in America, every country is in the same boat. So what I'm asking is we get a bit of context on this and understand that the information about this should have been out much earlier than just the end of January. It should have been out in December, when the real data was known that this was a serious problem and was spreading.
But if by late February scientists were warning policymakers that the UK could suffer 380,000 deaths without urgent intervention, it's fair to ask whether the government could have addressed this more aggressively and also whether the government should have been sending PPE to China.
Well, again, let's put this in context. The government all the advice that was given to them by the medical professionals and by the scientists, they have followed exactly to the letter. That is critical. Now, the whole point about this PPE point, get that again in context. At the time, we were understanding that China was getting under control on this issue, and therefore support from many other countries, not just the UK, to try and help China contain this. We did not know at the time that the data on this was far more extensive and should have been released. But however, that was trying to contain it in China, not let it spread. It turns out, because people were still moving out of China, that had already begun to spread. Once that was known, this government, other governments in France and all these other countries, then had to take the advice of the scientists in how to control it. And I think the government did do exactly what they were asked. We will learn later on exactly what was said to them and what they did. But my belief is, from talking to ministers, they followed the scientific and medical advice from start to finish. And now we must plan for a moment when we can start moving out and get the economy so that it is working again. Otherwise, the damage will be enormous.
OK, as I said in my introduction, you were once the leader of the Conservative Party. If you had once upon a time been the Prime Minister, would you have missed 5 COBRA meetings after the alarm bells had been raised?
Well, COBRA is a set of letters standing for Cabinet Office Briefing Room A. COBRA meetings take place all the time. Most of them are functional and planning meetings. When I was in Cabinet, the Prime Minister did not attend every single planning meeting.
But would you expect
even
the
on
Prime
an issue
Minister
in a
to attend a
crisis.
COBRA meeting in the grips of a global emergency?
I would expect him to have delegated to those relevant secretaries of state to run those areas that were meeting in the COBRA room. The key point here is the Prime Minister attends when it needs all of those departments to be pulled together for a particular function. I believe he did that. The key element is each of the secretaries of state working together is responsible. One of them normally takes a lead at a meeting like that when it's planning. So if it's a health lead, then they will have all the other relevant secretaries of state round the table and they will take the lead on it. The Prime Minister comes in when it requires an executive decision about something which has up till then not been decided. So it is normal for a Prime Minister not to be at COBRA meetings, only when his presence is absolutely vital, because that's what you pay secretaries of state for, to do their job and to run their departments and to coordinate activity.
Well,
so
you also paid the Prime Minister to do his job, in all fairness, Mr. Duncan Smith. With hindsight, should events like the Cheltenham races, which saw 250 people gather together in one place over the course of 4 days, should that have taken place?
It depends what the advice was. If the scientific advice and medical advice, as I understand it was, and I wasn't there, but as I understand it was, that it was okay to continue with those events at that time. So that is the critical issue. Did the government listen to the advice? I believe they did, but we will know later on whether that was the case or not. But I believe they did listen to that advice, and that advice was they were okay to go ahead at the time. Now, we may, in hindsight, say all the figures that were around, maybe that shouldn't have been the case. But the question for government, which you keep asking, is what advice did the government follow? And the government has made it clear they followed scientific and medical advice from their scientific advisors and their medical advisors. And I think that's the critical question.
Once the dust has finally settled and we are through this pandemic, would you welcome an inquiry to investigate what went wrong?
There will always be an inquiry to figure out what went right and what went wrong, and that will happen. My point here today is to try and undertake that now on the backs of leaks and suggestions from others, we don't know who they are, would be a mistake. What we need to recognize is the lockdown is working. We need to make sure that happens. We need to help and support the government in trying to get as much PPE equipment in as other countries are trying to do at the same time, and to get through this so that we can, as I've set out, plan to get the economy moving in a 3-phase process once we've got this under control. That's the critical bit. We should be talking to the public, saying there is a way out of this, here is how it is, and let's trust them to understand the difference between a lockdown measure and the fact that at some point we'll be coming out. That's the critical question.
Also the critical question is that we don't know exactly how long it is before the restrictions are going to be completely lifted.
No, not at the moment. But the key question for us is, at what point do we think it's going to be okay to be able to start moving the economy back out? And I think if you look at the other countries that are doing it, they're doing it at about the level of half peak of those who are arriving in hospitals, etc. That may be a target figure, but the government will have to figure that out under medical advice. But the key bit is, let's set out what the plan will be so the public, businesses and others can start to plan for when we move out. They'll know how it'll be done.